infraorbital nerve.
Yeah.
The conductor of the orchestra. So the same way as I would do in real life surgery, sickle knife. At the back here, if you dissect, you will see the temporalis muscle.
Yes.
You can see the fibers. So if I move
Longitudinal fiber, yes.
Yes.
there, temporalis muscle there, and the IMAX will come between the two pterygoids here. So now let's continue our dissection. So follow the V2.
The Meckels curve.
Let's follow the V2 backwards. And here would be the foramen rotundum. So I'm going to dissect this a bit more gently. There, guys. Foramen rotundum. Can you see?
Yes, sir.
Okay, the same way, so that's V2. So if I dissect here a little bit more, can you see nerves coming out from the infraorbital nerve? Can you see these nerves, guys, here?
Yeah.
That's your pterygopalatine ganglion here. This one here. So once we have identified V2, which is here, if you go downwards, that's your Vidian's nerve. Clear, guys?
Yes, sir.
Yes.
Okay, so we have V2 and the Vidian's nerve side by side.
Yeah.
That is a pterygoid
Wedge.
Correct. So this is Vidian's nerve. So this is where your sphenoid gets lateralized. This is where your middle pterygoid and lateral pterygoid meets. This is where you get lateral results of the sphenoid sinus. Okay? The same way, if I go above the V2 or rotundum, you will come to the maxillary strut.
Okay.
And that takes you to the orbital fissure. Above this. That's V2. That. Can you see the bone here?
No, not that.
Between, let me dissect a little bit more.
Yeah. I request the audience to pose questions, if any, please.
There, guys. V2, the bone in between, which is the maxillary strut, and you can see the superior orbital fissure above here.
Yeah.
So the orbital fissure above there. Clear, guys?
Yes, sir.
Okay. So you see the entire dissection here we did with a sickle knife and a Kaizen puncher. So now what I would like to do, here you can see the ophthalmic artery.
So once can you please just tell the landmarks
infraorbital artery.
in aspect to the sphenoid sinus?
Can you see, guys? The artery that follows the infraorbital. So now what I would like to do is to identify that comes from V2 and the nerve that comes from Vidian. This is pterygopalatine ganglion. It's not often you can see this very nicely. Yeah? The next step, I think I'm going to use a piece of gauze or something. There's a lot of fat, so I need some piece of gauze or something. So I'm going to cut the ganglion. Okay, so now, so I'm going to push this. I've already cut the pterygopalatine ganglion now. I'm going to push this away. Can you see the lateral foci of the pterygoid? Wait, let me get something to, just a piece of gauze, fine. Can you see, guys? This is just pterygoid, the lateral wing, lateral pterygoid, yeah? Lateral pterygoid plate. Just use a, so, suction first? Can I have a second? So let us just clean off the fat that's coming in the way. Okay? So that I can show you the next structure. Okay. Please elevator again. So I'm going to use a Freer's elevator. You can see the middle pterygoid. Okay. Here. Guys, beautiful.
Yeah.
Anyone from the audience wants to ask a question, please send the mic. Please.
Okay, now you can see it very nicely. Now I'm happy. That's the subperiosteal space that you need to go in. Here you can see the pterygoid wedge itself. The middle pterygoid, infraorbital nerve, middle pterygoid wedge. That's the this is the infraorbital nerve that forms V2. There. Okay. Now we have a much better view now, yeah?
Yes.
V2. Infraorbital nerve. Agree? Vidian's nerve. Can you see?
Yes, sir.
Okay. So this is now the middle pterygoid. On the side, this is the lateral pterygoid. So I'm going to dissect the muscles away from the lateral pterygoid. There's a lateral pterygoid wedge there. And that's your V3.
V3.
This is your foramen ovale.
Yeah.
Can you see clearly?
Yes, sir.
There. Foramen ovale, you can see the anterior branch and the posterior branch very nicely. The posterior branch goes between the two heads of lateral pterygoid. There's a song by Dato called Leah. Lingual nerve, inferior auricular, auriculotemporal. Can you see, guys? The anterior branch and the lateral branch. Okay, that's the infratemporal fossa. Any questions about this?
No, sir, no.
Okay, fine. So, Karthik? Yeah.
Sir,
So now we go to skull base.
Sir, the level of parapharyngeal ICA, one delegate want to know about that.
What's up?
The level of parapharyngeal ICA, intercarotid.
Parapharyngeal ICA.
Yeah.
To reach the parapharyngeal ICA, we have to dissect much more. We have to go beyond this.
Okay.
If you continue your dissection behind here,
Yeah.
you will actually come to the middle meningeal artery, foramen spinosum.
Okay.
So your artery is way too far to the back. The ICA will be way at the back here. Here, beautifully, you can see foramen ovale with anterior and posterior branch. You continue your dissection, you will have middle meningeal artery and foramen spinosum. Your ICA will be at the back here.
Okay.
Yeah?
Fine.
Yes, far posterior. Unfortunately, 1.5 hours. I think I better spend it on skull base, yeah? Okay, guys, shall I go skull base now?
Yeah, please, go ahead, sir.
What's the time now?
I have an announcement. Anyone who would like to have a cup of hot tea, it is served outside. You may go and have the tea.
So we have 40 minutes more.
Okay, fine. So can you send a hot cup of coffee for Teja, me, and Alina as well?
Sure, sir.
So I'm now going to open the skull base.
So,
Sure.
meanwhile, can you just reorient the audience once again? All the landmarks, please.
Sure. Just give me 1 minute. I'll just remove the keel first, and then we are good to go.